that you can do for a stiff big toe joint. So why is this important? Well, there are a couple of conditions which can affect the big toe, and when it becomes stiff and painful, it can limit the whole of your movement, so it makes walking difficult, jogging difficult, sometimes even standing difficult. So if we look at the hand, we can see that the thumb joint is quite similar to the big toe joint. So we've got a skeleton here, and what you're seeing is the shin bone here, and then you've got your heel here. This is the sort of sole of the foot, and then this is the big toe. And the big toe joint should normally be such that the toe itself is relatively straight. But there are two conditions which can occur, either through injury or simply later on in life, and they affect the big toe. And the big toe is called the hallux, and so they are hallux something. One is called hallux valgus, and the other is called hallux rigidus. So, hallux rigidus occurs because you get a little bit of thickening of the bone of the big toe joint here, and so the big toe becomes quite stiff, and then that combined with the fact that the toe often doesn't move very much in stiff shoes means that that area becomes slightly painful. Now that can also coexist or change into a hallux valgus, where this toe moves slightly inwards, and you develop a sort of a raised area or a bunion on the outside of the toe, so on the inside of the shoe, the inner arch of the shoe, and the toe, rather than coming straight, just goes at an angle, and it becomes quite sore and quite painful. So what can we do about this? Well, one of the reasons that we get pain is that the area doesn't move enough, and that the bag which surrounds the joint, which is called the capsule, starts to become a little bit thicker. So it should be quite springy and elastic, and it can develop into a sort of a leathery type joint. So there's an exercise that we can do, and it's an exercise called a traction movement, or sometimes technically called a longitudinal mobilisation. So when we take our toes or our feet, we can bend and we can straighten the toes, but what we can also do is take hold of the joint and pull it. And if I pull in one direction, my hand is pulling in the opposite direction, what happens is that the toe joints just become a little bit separated, only by, fractions of a millimetre, but what that can do is change pressure within the joint and be quite pain relieving. So what we do is we take hold of the joint and we draw it slightly. So if we have a look at that in a little bit closer, what I've done now is to take my shoe and sock off. So here are the bones, and you can see that the toe joint attaches to the foot joint. And what we're going to do, and rather than bending and straightening the toe, is we're going to hold on to one part and draw on the other. So what I do is to take hold of my foot with my hand over the top, and then I'm using my hand around my toe joint, and I'm pulling my toe joint in that direction, where and at the same time drawing my foot in this direction. So all I do is literally do that movement. So I'm separating my hands, and I'm creating a very, very gentle pulling force on the knee, and that's called a longitudinal mobilisation because it's pulling lengthways. And what I do is gently oscillate that over a period of about a minute, and initially it will feel a little bit sore, and then gradually you should start to feel that soreness easing off, and as it eases you can continue with that until the pain either stops easing or it goes completely, and then you have a rest, have a little bit of a breather, and then do the same thing again, hand over the foot, drawing in this direction, hand gripping round the toe, drawing in this direction, and we would do another set. And you do 2 sets of that, and you continue that movement each time for about a minute, and I would do that in the morning and in the evening, and that will just relieve some of the pain of a big toe condition, so either hallux valgus or hallux rigidus.